Hello, my name is Dr. Aleksandr Dayanayev, and we get a lot of questions about dental extractions. So today we're going to shine some light on dental extractions. The first question is, what is dental extraction? Well, extraction is basically a removal of the tooth from the mouth. The next question is, why would a dentist recommend tooth extraction versus a root canal? Well, sometimes the root canal is no longer possible, right? And in that case, the dentist would recommend to extract the tooth. For example, if let's say the tooth decayed below the level of the bone. So there's no sense of doing a root canal because the tooth simply will not survive after that. So the extraction would be recommended. The next question is, do dentists give pain medication after the tooth extraction? And the answer is yes. For the most part, you will be giving prescriptions for maybe some antibiotic if it's necessary and some painkillers. Now, the painkillers, to take painkillers, it's optional. Now, if you don't have pain from it, you're not supposed to take any medicine, right? But you will take medicine for as long as you are uncomfortable with it. The next question is it always necessary to remove wisdom teeth? And the answer is no. It's not always necessary. Of course, if the wisdom teeth giving you some trouble and they're supposed to be removed, yes, by all means. But there are some patients that still have wisdom teeth. For example, I still have mine. There is enough space for them and they're growing straight so I can use them. So like in my case, you can save your wisdom teeth and you don't have to remove them. The next question is tooth extraction necessary before getting an implant? Well, yes, the dental implant, the purpose of it is to replace tooth, right? So if you still have the tooth in that same area, then you cannot replace it with an implant. To do that, you would have to remove whatever's left of that tooth, and then you would have bone graft, of course, and then place an implant. The next question is tooth extraction necessary for braces? There are some cases in which orthodontists will recommend that you will extract some teeth in order for the braces process to be smoother or in order to achieve the ultimate goal. But is it always necessary? Not really. So some patients will need it, but it's not the majority of people. The next question is, when is the tooth extraction recommended? So usually your doctor will recommend tooth extraction when there is no other treatment possible anymore. And the tooth is done. Basically, there's no way to save it any longer, or the saving would not be justified. Like it could be saved, but it would not last you a very long time. Next question is, what should I expect during a tooth extraction? So first of all, you should expect that you would come in and you would get anesthetic. We don't do no anesthetic extractions anymore. Most likely it's going to be a local anesthetic. Very rare the oral surgeon will choose to put you to sleep for that, but for the most part there is no sedation used, and he's just going to make the area numb and so you're comfortable with it at all the times, and then he will remove the tooth. Of course, once he's removing the tooth, he's going to also clean the area and he's going to place his bone graft, put a membrane over it, and then suture the gum over the top of the hole, so you will be comfortable all the time. After a couple of weeks, you would come back and the surgeon will remove the sutures. He will instruct you, depending on the type of sutures he's using, he will instruct you on when to come in to get the sutures removed. The next question is, can tooth extraction cure periodontal disease, gum disease, right? Yes and no. Of course, if you don't have a tooth, you don't have the gum disease anymore, but you're not going to gain all the bone that you lost in the gum disease just by pulling the tooth out. So that is also not the ultimate goal. The ultimate goal is for you to keep your teeth, right? So extraction is not really the right treatment for it. However, at the very end of it, when you lost all the bone around that tooth is no longer possible to be saved, and then, yes, by all means, see an oral surgeon and they will remove the teeth. The next question is, can a dentist just pull the infected tooth? Well, yes and no. Dentists can pull teeth, but a lot of times you would want to see a professional about that, meaning oral surgeon who had special training, because you don't want to just remove the tooth. You also want to fix the damage that is done to the bone around the tooth. when the tooth is infected, the bone is also melting around the tooth. So you want to fix that. It's kind of like when you have a tooth that has a cavity, we don't just clean the cavity and leave the tooth alone. We're also putting a filling in it, right? So that's what you would need. You would need tooth removed and bone fixed. Next question is, how long does it normally take for healing after the tooth extraction? There's different structures, right? So the gum is like a skin. When you cut it, will heal relatively quickly. It will take probably about a week or so. But the bone itself will take a lot longer. So healing of the bone or replacements of the bone, regeneration of the bone will take up to 6 months. The next question is the bone graft necessary after the tooth extraction? Well, the answer is yes, it is necessary in most cases. Why? Because you can imagine, if we remove the tooth, the bone is kind of will fold into the hole where the tooth used to be. And the height, the level of bone that we used to have will be diminished. And of course, we don't want that, because the bigger the bone we have, the better it is for us for restoration for future. So therefore, we want to hold on to the bone. And the only way to do that, if you're actually getting a bone graft procedure done right after your extraction is done. So, yes. It is beneficial to have bone grafting after the extraction. The next question is, how painful is a tooth extraction? Well, it is not painful at all. The extraction, you should be numb before they even start the extraction. So the only thing you're going to feel is injection. I know, for example, here at Steinway Family Dental Center, we use topical anesthetic, which means it's a cream. So we put some cream over the area that the needle is going to go into. Then we warm up our needles and we warm up the medication. So we reduce the amount of sensitivity you have, a pain you have from the injection, but you're still a live person, so you're going to feel something. And we're going to help you to deal with it when you do. And then after that, the extraction itself, you will know that they're doing something, but you wouldn't be able to tell what it is. So it's painless. The next question is, if you need tooth extractions, when would you need to see a regular dentist, general dentist, versus an oral surgeon? Now, depending on how difficult the extraction is, your dentist will recommend you to either see the oral surgeon or he will just pull your tooth out for you. For example, let's say it's a baby tooth and your child needs a baby tooth extracted. The dentist will probably help you with that. I doubt he's going to send you to an oral surgeon for it. But, however, if it is a surgical extraction, a more complicated extraction, or extraction of your wisdom teeth, then, of course, the oral surgeon should perform that, and your dentist will recommend that you see an oral surgeon. Next question is, what kind of anesthesia is available during the tooth extraction? There's few types. Number one, you can have local anesthetic, which means that only the area where that tooth is anesthetized, which means that's what's going to get numb, right? And the rest of your mouth is not going to be numb. There's also anesthetic used, and it's called the block technique, when the whole quarter of your mouth is blocked, and then you don't feel anything on that quarter during the procedure. Of course, a couple hours later, it's all going to go away and your sensitivity will return. The next one would be to put you to sleep, right? So when you're asleep, you're still going to get injection, because just because you're sleeping does not mean you don't feel anything, right? You're just sleeping and you're not reacting to it. So therefore, it would be a combination of local anesthetic or a block anesthetic. And again, both of them are administered locally in your mouth, so you don't feel any pain from the procedure that is being done.